Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 192 of the Ask Dr. Angela podcast. We're going to jump right into today's question, which comes to us from The Bump. You all know that I'm one of the featured experts on thebump.com, and the question that was recently posed to me is the following. Dr. Angela, I've previously had vaginal births. However, my last pregnancy, I had a C-section. Do I have to have another C-section? That's a great question. And I gotta tell you, I feel like I answer this question at least once a day. And the answer really is quite simple. Number one, it's going to depend on whether or not you're delivering at a facility that can accommodate vaginal birth after C-sections. I'm just going to refer to that as a VBAC. Do you have a hospital that has anesthesia, staffing, basically the ability to accommodate such a delivery? There are some hospitals that don't allow VBAC, so that's first and foremost. Secondly, does your doctor perform VBACs? That's huge. There are a lot of physicians, believe it or not, that aren't supporters of VBAC. And I don't happen to be one of them, but that's a really important question to pose to your OBGYN. And then last but not least, what was the indication for the C-section? The one thing that you certainly have in your favor is that you have a history of having successful vaginal deliveries. When I talk to patients about indications for C-sections, was it for something that was completely out of your control? Was it for like a placenta previa? Was it for multiple gestation where the presenting twin wasn't vertex or head down? Was it for a baby that was breech? It could be any number of factors. Or was your C-section due to something else, like an arrest disorder? And anytime that I start talking about arrest disorders, that raises a flag for me. Whether it's an arrest of dilation, an arrest of descent, i.e. baby just would no longer come down into the pelvis. Those disorders, i.e. the arrest disorders, are typically very telling as well as very predictive of success rates with someone that's going to attempt a VBAC after a C-section. I actually just saw a patient the other day. I did a previous C-section. And, my first question to her at her new OB visit was, how are we delivering this baby? And she said, well, Dr. Angela, I would just as well, I want a C-section. And so I said, okay, that's cool. Then, if we're going to schedule this as a repeat C-section, we typically do that at 39 weeks. And when I delved a little bit further into her history, I discovered that the reason for the original C-section was because of an arrest of dilation. She said, I came in, I got 6 centimeters, and then I just didn't progress anymore. So we decided in her case, or she decided that she wants a repeat C-section, which typically, again, is done at 39 weeks. So I hope that this has provided some insight for you with regards to the whole dilemma to VBAC or not to VBAC, who is or who is not a good candidate for this, and what questions perhaps to go over with your OBGYN. For the young lady that submitted this question to me via the bump, I think that you'll be fine. I mean, you've got a history of previous vaginal deliveries. And again, depending on the indication for this last C-section that you had, and as long as you have a physician that is willing to allow you to have a VBAC or to attempt a VBAC, and again, as long as you're delivering at a hospital that can accommodate it, I think you're going to be golden. Just make sure that you talk to your OBGYN about it. Thank you so much for that submission. I love getting questions from you all, hearing from you all, whether it's the shout outs on social media, the questions that I'm getting via email. It's just all very, very, very exciting, and I'm thrilled to be doing this not only with you, but for you. And believe me, it's for me too. I get so much enjoyment from doing this. Thank you again so much for tuning in, following along. If you have a question or topic that you would like discussed or addressed on the podcast, you know how to reach me. www.askdrangela.com. That's AskDrangela.com. That is where you can reach me easiest. That's my website. Everything is there. All of my social media channels, whether it's YouTube, podcast, Instagram, Facebook, Twitter. You can directly email me. The site is very, very, very friendly. I'm hearing from you guys all day, every day, and the questions just keep coming. And I appreciate that so much. In closing, I've got a really good friend from undergrad. His name is David Greer. And all month, he has been posting pictures and snippets about famous women of color who have made a difference. This month happens to be Black History Month, and recently he featured Fannie Lou Hamer. And what he has been persistently putting in his comments about these amazing women is the following. She was warned, she was given an explanation, nevertheless, she persisted. I like that. Warned, given an explanation, nevertheless, she persisted. The power of women, as demonstrated over the years and even now, not to be taken lightly. Remember, ladies, know your worth, know your value. We can, and we will. Until next time, look better, feel better, be better. Looking forward to reconnecting on episode 193 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.